Joining me now is Dr. Ebony Hilton, a critical care physician and associate professor of anesthesiology at the University of Virginia. She's also the co-host of the B Word Unpacked podcast. Dr. Hilton, good to see you. You talk about this a lot. You tweet about it and you've discussed this. So this CDC, this new finding by the CDC is absolutely not news to you about the fact that African Americans who did not have the same life expectancy as white Americans to start with before the pandemic are now suffering more seriously than white Americans are.
Yes, for sure. What we know, Dr. Martin Luther King said it best, of all forms of inequality, injustice in health is the most shocking and the most inhumane. And what we're seeing with this pandemic is really strangely reminiscent for me of the Tuskegee experiment, really, to be honest with you, because of the fact that we've studied Black and brown people dying at higher rates for the last 12 months. When it came down to writing the protocols by which we're going to give interventions, this vaccine that could potentially save their lives, we are largely left out of the protocol on who is prioritized in getting that intervention. And it's something that I really hope we stop now to pause and say, is what we're doing right, particularly when we're losing life expectancy of 3 years and 6 months for Black men?
Yeah, I mean, the distinction, I'm going to ask my controller to put that graph up again, the distinction between Black and white people and the rate at which they live is remarkable. And there was a time period during which we were starting to close that gap, but we don't do that anymore. And what's frustrating is that we've been talking about this for a year, since the beginning of coronavirus. We've been discussing the lack of access to testing, the lack of access to diagnosis, and then the likely lack of access to vaccination. And yet it's all happening, despite the fact that we've been talking about it for years. How does it actually change?
Yeah, it changed by making equity actually a priority. When we're talking about the phase rollout, for instance, phase 1A and phase 1B, we were given a lot of praise for how this was allocated. But if you look at phase 1A, healthcare workers, 60% are white. If you look at nursing home residents, 78% of nursing home residents are white. It costs money to place your family members into those facilities. If you look at phase 1B, when we initially said 75 years and older, the life expectancy for Black people was only 75. For Black men in Virginia, the life expectancy is 72. So that is largely exclusionary for them. And even if we go further and look at employment, if we say that you have to be an essential worker, well, unfortunately, just like we had a health crisis, we had a financial crisis that's caused unemployment for millions of Americans. And if you are African American, you are more likely to not have a job right now. So we base this criteria of this life-saving intervention on age and on employment, two of which don't line up for Black and brown people. And it's just simply not right.
One of the things we've talked about as we got closer to a vaccine was inherent hesitancy at a greater rate amongst African Americans to taking that vaccine than there was in the general population. How much of the issue is that versus just access to the vaccine? Because I've heard from people like Dr. Ayla Stanford in Philadelphia who says you can give her every last dose of vaccine that she can get her hands on and she'll make sure it gets into arms. She's got a lineup of Black people waiting to get that kind of stuff. So how do we make sure that we don't associate the hesitancy on the behalf of some Black people to get the vaccine with the idea that lots of them can't get the vaccine and want it?
Right. I mean, it's one of those things very early on. I think this narrative of hesitancy was pushed out there. And of course, we have to talk about the impact of Tuskegee, right? That was it ended in 1972, which was just 10 years before I was born. But in looking at the works of Tuskegee, it was withholding of a medication, not the giving of a medication. So for one, putting that education out there. But also when we're talking about hesitancy, that's a scapegoat that's used for the African American community, but it's rarely, if ever, brought up about hesitancy for the white American community. We know anti-vaxxers are largely white educated women. We know that we just had this huge movement of COVID hoaxers and anti-maskers, that 74 million people voted for Donald Trump, right? That said that this was a hoax and I don't want a vaccine, but that's not used as a scapegoat as to why white Americans won't get vaccinated. So I asked the medical community, if we know our structures by which we're phasing or we're rolling out these phasings don't include Black people, if we know that registration requires Wi-Fi, and we know that Black children back in August could not perform their school duties because they did not have Wi-Fi access, If we know that in Black communities, you're twice as likely to not have a hospital, and that 70% of all pharmacies are within predominantly white communities, then we have to stop blaming the victims. We have to stop saying this is just hesitancy, and we have to actually fix the system and make sure that equity is mentioned in the foundation of these protocols and not an afterthought, because that's why we're seeing only 6% of the 42 million doses of vaccines that have gone into the arms in America has actually gone to Black people who are dying at higher rates.
Dr. Hilton, thank you for your time this morning. Thanks for the work you're doing to get the word out. Dr. Ebony Hilton is a critical care physician and associate professor of anesthesiology at the University of Virginia.